Hi everyone, and welcome to this video. Alright, so in today's video I am going to share with you something that I recently had done as recent as last Wednesday. So I think today we're Monday, I think this is the 20th of October, and I had something done last Wednesday, and it was my lips. So I have discussed in previous videos about my having had facial injections done in the past, as well as my lips. And the last thing that I ever had done to my face was before I came back to Florida, while I was still living in Tennessee. I had Xeomin put here and just in some fine lines around my eyes. And Xeomin is like a knockoff of Botox cosmetic, and so it sort of relaxes like the fine lines in between the eyebrows and the fine lines that we get around like the crow's feet. So prior to that, I have not had any injectables other than the Xeomin in at least 3.5 years. So I've always sort of mentioned my face as being kind of empty meaning I didn't have any fillers. But last week, I decided that, after a consultation, of course, that I was going to have my lips injected with nothing permanent. It is a temporary filler. And the one that the injector, who is a plastic surgeon's PA, she recommended this product, which is, trying to avoid the glare here, Restylane KYSSE, and that's KYSSE. Now this is a lip filler, and it is not permanent, but, and of course results vary according to the individual. You can get anywhere from about a year to maybe like somewhere between 9 to 12 months this product will last in the lips. Now of course a lot of this varies, and it varies because it depends upon the individual person. Some people, like myself, I tend to metabolize fillers and injectables faster than, say, the average person. And I'm not really quite sure why that is. That's one of the reasons why I don't like Botox, Xeomin, Dysport. They just don't last at all. So you're spending all this money on a filler or an injectable, and it just doesn't last. That's one of the reasons why I don't inject my face at all, because they just don't last and it's costly. And you know, if you've had injectables before, you know the associated costs with having the face injected. But this pamphlet, so if you're on the fence about having your lips done, or you've heard of this product, this is the pamphlet that is offered by the company. And to just give you an idea, they have some before and after photos in the, trying to watch the glare here. So they've got like a before and an after. So now the PA that I was working with with the consultation, she doesn't like to use more than one vial on most people, and she does inject with a light hand, not a heavy one. So she assured me that after looking at my lips, that one vial would be more than enough, and what to expect. So last Wednesday, I went into the office to have this done, and instead of using topical numbing to numb this area, of course, for being injected, we used lidocaine 2% with epinephrine, which is the only cane derivative that I can have. I have been allergy tested with that one specifically, so that if I ever need to have a dental procedure done, or more injectables, or I need to have general anesthesia, or even local for that matter, they can use that specific one, because I have had a severe reaction to topical xylocaine in the past. So that's the one that she used to numb me. So instead of doing like a block of numbing where she would maybe inject here, 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 and here, so like maybe 6 injections to just numb this whole area, she did sort of what like a dentist would do, where they'll lift the lip and then go up into the gum and numb there. I will say that I still felt it. I still felt enough that when she would inject, I would grip the chair a little bit. But of course, you're going into the lips. The lips are very, very delicate. They're also quite vascular, meaning that they can tend to bleed. In the past, when I've had my lips done, they bled a lot. And that's what I mean by vascular, is that it's just a lot of like maybe blood vessels in here. I'm not sure the anatomy of the lip, but I would bleed quite a bit. Interestingly enough, I hardly bled at all while she was injecting. So I don't know if that's her technique, or if that's just my body just not bleeding this time around with the lips being done. I have not had my lips done for well over 10 years. So this is the first time that I have my lips done in quite a while. What I had done previously with my lips, I mentioned it in one of my previous videos, was I had silicone micro-droplets placed strategically in my lower, mostly my lower, and a little bit in my upper lip. Now those have settled down quite a bit, to the point where one of the reasons why I had a consultation to have my lips done last week was that I'm noticing volume loss in my lips, and that's with a permanent injectable already in there. So I did decide to go with this product, and we used one vial, and this is the result. So my lips, they are not settled down yet, so we're not even quite at the 1 week mark. But they're still rather puffy. And so I said I had them done on Wednesday. By Friday, I called the office, because even now, just running my finger across my lip, my lower lip, I can see that I'm doing it, and I can sort of, kind of feel that I'm doing it, but there's a very numb sensation across the lower lip. There had been across the top. The top no longer feels numb. And then if I press here on the lower ridge, it's very, very puffy. And it feels swollen, but it also feels like, if I didn't know any better, there's an implant in there. But there isn't. It's just the filler sitting there, and it is still, I'm still going through the stage of the filler settling. It's still in that settling process, in that settling stage. So I do have, she did forewarn me that we're looking at 2 to 3 weeks before this is going to, the final result is going to be visible. So I still have some puffiness. So this is puffy for me. One thing she did do is when she was finished, she did take her fingers, of course she had gloves on, and sort of gave everything just a little, very, very gentle and fine pinch. That's not something that you do, that's something that she does, and that's just after she's finished with the final injections. But yes, it does feel strange. But Friday I did call her, and she also had hers done on Friday, so one of the other PAs in the office did her lips, and she said, I'm feeling the exact same thing that you are. She said, so don't panic. This is something that you need to have some patience with within the first to about the 2.5 to 3 week mark. So if you are thinking of having this product in particular, the Restylane KYSSE, injected into your lips, and you have some kind of an event, pictures, a trip coming up, anything that you're looking forward to, I would highly advise you to have this done at the very least a month in advance, so that you can, so you know what to expect, that you have a waiting period prior to knowing what your final result is going to look like. So the first couple of days I could eat, but the recommendation was don't, go for a big sandwich where you have to open your mouth wide. I probably would avoid the dentist for the next 2 to 3 weeks afterwards too, because you're sitting at a dentist and they're manipulating your mouth, and maybe you need to have x-rays done and they're in your mouth and stretching your mouth out and your lips, and that's probably not the best recommendation to have a dental appointment within 3 to 4 weeks after having your lips injected. Again, how long does this last? About a year. About a year. It's not permanent, but depending on the individual and how quickly someone metabolizes fillers and injectables, you're looking at about a year, 9 months, maybe on the low end, up to a year. As far as cost is concerned, it was $700 for one vial of injectable. This particular injectable did come with a second needle, and if you have a good injector, they will change out the needle at about maybe the halfway point. And the reason why they want to change the needle is because every time they're going in and injecting, these needles are so fine, they're so small and so fine that even injecting just into skin will dull that very fine tip. So they can change out that needle and at the halfway point, and then that also will be a little less painful when they change the needle, because you really don't want to use a dull needle while you're injecting the skin or the lips. So yes, I may be having a little bit of difficulty, not really speaking, but I've always just had a very peculiar mouth, and so I'm very self-conscious of my mouth. So she could see by looking at me that not only had I lost volume, even though I had a permanent filler in there, you know, my upper lip is not straight. My lower lip isn't even straight. So, you know, she was trying to compensate by maybe adding a little bit more here and a little less here, to try to make my mouth look a little more even. You know, some of us are blessed with a nice, even set of lips and a smile, and some of us aren't, like myself. So, difficulties for me. Eating, maybe the first 2 days, I just was not really enjoying my food because my lips felt so numb. So it's interesting that while you don't think about your lips being involved in the enjoyment of your food, it's interesting. You think it's all in your mouth, like it's your cheeks, your taste buds, your tongue, and then swallowing the food, that's all part of the enjoyment of eating. Your lips have something to do with it too, believe it or not. And I was not enjoying my food Wednesday evening into Thursday. And then, of course, Friday I called the office, and she reassured me that all of this is going to dissipate at some point within the first to no later than the third week. So I'm looking forward to seeing what the final result is. One thing that's been nice is I have not had to wear any lip liner, no lipstick, no chapstick, no tinted moisturizer on the lips at all. My lips do seem to be speak. I can talk, I promise. They do seem to be a little bit flushed in terms of like the color. So they are a little bit pink on their own. Okay, so I'm also going to show you, I think my cat is sitting on them. Oh no, sorry buddy. Oh no, he's not, sorry, I didn't mean to move you. Cat moved unnecessarily. So she gave me 2 samples, and these are 2 things that I have been using at least 2 to 3 times a day. One of them is arnica, just a little sample of arnica. And arnica, as some of you may be familiar with arnica, it comes in tablets, usually like a sublingual tablet, as well as like a gel. It may even come in cream form too, but I don't know. I'm just familiarized with the gel. And I would take a Q-tip, a clean Q-tip, and just dot it in there. And I would use the arnica first and just apply it. Oh, it feels good because it's cool. Apply it on my lips. That's something else that's hard to do, is bringing my lips together like that. It's just so strange to have lip problems like this, because even when I had silicone micro-droplets put in my lips, injected into my lips, I did not have issues like this. I did not. I had swelling, but it was only for the first day, and then boom, it was gone. So the next sample she gave me is something called nectar. And what nectar is, she was saying that the nectar is like, it's also a gel, has a little bit of a scent, does not taste good. It does not taste good, but we're not putting it in the mouth, we're putting it on the lips. So I take the other end of the Q-tip and just a little bit there. So I'd put the arnica on first, let that dry, which it dries quickly, and then follow it with this nectar. Ooh, yeah, it doesn't taste very good. But she gave me these 2 samples, and I put them on probably 3 times a day. Maybe I need to do it more, I don't know, but it does keep the lips moisturized. That's important because they may start to feel a little dry. And I may have already mentioned this, but I haven't worn anything on my lips to work at all. And so I haven't really even needed to. One other thing that was mentioned that will help with the swelled, puffy look, as well as maybe even that numb feeling, icing. 5 minutes on, 5 minutes off throughout the day as often as you can. Now, of course, I'm at work. I can't be standing there while I'm working with an ice pack on my mouth while I'm working. So while I'm home, I try to remember to do it. I do have some ice packs in the freezer, and I'll just put the ice pack, like, you know, right in my mouth. And they're the plastic kind, the hot cold gel, where you can put them in the microwave or in the freezer, hot cold, and I'll just lay it, like, my bottom lip on top of it, and I'll actually put it in my mouth and close my mouth over it so that the top lip can get chilled out as well, and then I'll lay it across the top too. 5 minutes on, 5 minutes off. I'll do that a couple of times. So I will do that before I go to bed this evening. I'm trying to think of anything else that I can tell you. I mentioned the cost, so it's $700 for one vial of that, and it should last up to a year. So we'll see. I will, you know, you'll see me in my videos. I'm going to try to get back on at least somewhat of a better filming schedule for you. And so, you know, whether I do an update video or not, as I make videos from this point forward, you'll see the progression of the lips and how they settle down from what you're seeing right now. As for bruising, I am notorious for bruising. I'm just one of those people that bruises really easily. Now my lips in the past, even just having anything injected in my face, bruise everywhere. I looked like I got beaten up. Oddly enough, no bruising with the injectables for the lips this time. Very, very interesting. So I don't know if it's my lips or if it's the injector, because sometimes who's injecting you and their technique can make all the difference in the world. The only little bit that I even saw was at where the needle actually went in. So there was an injection point where the needle maybe went in over here. You may even be able to see. Not sure. It's late in the day too. It's probably pushing 7 o'clock right now. I also apologize. I look very tired. I took a nap. I fell asleep with what I had left of makeup on from work from 3 o'clock this morning. But yeah, I mean, this is not the best lighting right now. But yeah, just tiny little injection points with maybe 1 or 2 that had like the finest, minute little bruising at all, but not enough to even put concealer on at all. So I'm looking forward to seeing how my mouth is going to react overall, what the final result's going to be. That's going to be what it's going to be for hopefully 9 months to a year. We'll see how long this lasts with me because of my rate of metabolizing injectables and fillers. There was a point I was going to make. I can't remember what it was. I'm sure it'll come back to me. I don't remember. But anyway, Yeah, I'm okay. I'm okay with how it looks right now. I just wish that this feeling of like I have an implant at this lower ridge right here. I'm looking forward to that going away, and then I'd like to get some feeling back here. But she said that's all normal. That's all normal, so nothing to be concerned about there. But I don't have anything else in my face right now. I can still, move my face quite a bit. This has been a little bit of an issue for me because I don't have a symmetrical mouth. It's crooked, and I've had to use some makeup tricks to try to compensate for that. And I've just noticed volume loss. And because I haven't had my lips done in so long, I just noticed that there was some fat loss and some volume loss. And it just naturally occurs over time. But yeah, this is the only thing I'm going to have done in terms of injectables to my face. I said that I would not have anything else injected into my face, and I'm not going to. I do have some interesting things coming up very, very quickly, so I need to stay on a regular filming schedule so that I don't want you to miss what is coming up for me here very, very quickly. And I'm losing daylight too, I can tell. It is, it's a little bit dim in here right now. I really wish I could remember what it was I was going to say. This is what happens when you get older. Over 50 brain, 54 right here. So I think I was just going to say something about, how we feel about ourselves as we get older, even if you're younger, that if you don't feel good about yourself, I never understood when somebody would say that. Not that I always felt great about myself, but going and doing something like this, having an injectable or having plastic surgery or having some other procedure done to help make yourself feel good about yourself, to increase your confidence and your self-esteem, that actually is quite important, especially today. The world we live in is just full of judgment, especially amongst women. Between women, we look at each other, and whether we're conscious of it or not, we do pass judgments on each other. And I never thought I would say this, but being 54 and where I am in my life, with my self-esteem where it is and my confidence level in myself, I'm noticing that I need to take maybe a little bit better care of myself and consider this to be part of like a self-care. Now, although I can't inject myself and I would never do that, I can have someone else, I can pay someone else to do a little something to see if I will feel, good about myself. And it's very, very important for you to feel good and confident about yourself so that you can move through your life and go forward, whether you have a partner, family, friends, or not. Because there's those of us that don't have any of those people in our lives, that you can feel really good about yourself. It's very, very important, the thought process in your mind about yourself. It's really important. I think I do remember what it was I was going to say. So if you decide to have this particular product injected, if you decide to go with that after a consultation, if you do not like the result, you can go back and there is an injectable to dissolve it. So I thought that would be an important point to mention as well. As of right now, I'm okay with how my mouth is looking. It is swollen still. There is still some swelling here, but I'm going to give it a chance. I'm going to give it the 3 weeks, up to 3 weeks or so, to settle down to see what the result is going to be. And of course, I will keep you updated, and you'll see me in the videos over the course of, you know, future videos, future weeks here coming up. And you'll see how my mouth is progressing with this injectable in it. So I am looking forward to that. And yeah, I can feel my lip stretch a bit, my lower lip, as I try to smile. One thing that I did notice that I have a little bit of trouble with this is my water bottle for work. It's a glass bottle, and it just has a basic size mouth on it. Trying to drink. About maybe 4 times out of 10 drinks I take, it's running down my face. It's running down my cheek, my face a little bit, because it is hard to get the mouth to sit on the opening, the mouth of the bottle to drink. So that's probably my only complaint. But yes, the first week was probably the most difficult in terms of enjoying my food, especially day 1 and day 2, enjoying my food. That was probably not that much fun, but you know, this will settle down. I'll ice it. Icing on and off, like I mentioned, is also very important. And then of course using the arnica and the nectar to keep it hydrated. And you know, this arnica is used primarily for bruising and swelling. That's what arnica is good for. And then the nectar is, the nectar has B vitamins and moisture. And both of these are like a gel, but moisturizing as well. All right, I'm losing daylight here quickly, so I am going to end this video right now. Thank you so much for tuning in, and again, thank you for your patience with my uploading schedule. Has not been good at all, but I have a microphone. Hopefully the sound is improving, and as usual, I always say, survive your life. I know you can do it because I'm doing it too, and every day can be a struggle for some people. I completely understand. I really do. But I'm in your corner, okay? So take care, and I will see you next time. All right, bye.